Hey guys, Dr. Shepherd here. I wanted to talk to you guys a little bit today about insomnia and what you can do about it. So first things first, if you've never had insomnia, first of all, why are you watching this video? And second of all, it's super uncomfortable. So it's like one of those basic human needs like eating, breathing, drinking coffee. It's one of those things that you just need to do. And when you can't do it for one reason or another, it's super uncomfortable and so frustrating. It can be a huge source of distress for people. But luckily, insomnia is something that's treatable and totally manageable, and many people with the right treatment can get back to sleeping a good amount again. So what I am not going to do in this video is start out by telling you all the ways that insomnia can ruin your life. If you are someone who does have insomnia, you are already acutely aware of these things. So we have seen study after study that has, come out in the media or been talked about elsewhere that talks about how bad it is for you to not sleep every night. And these studies are generally targeted at people who are choosing not to sleep at night. But what happens is people with insomnia who cannot sleep at night take these studies and run with them and say, oh my God, something terrible is going to happen to me. So I have had more than one patient who has had this self-perpetuating insomnia where they say, I know about this, and this as possible negative side effects of not sleeping. So if I don't go to sleep right now, all of this bad stuff is going to happen to me. I'm going to have a heart attack, or I'm not going to be able to concentrate for my test tomorrow. And if you're sitting there telling yourself, I got to sleep, or else this terrible thing is going to happen, guess what? You're not sleeping. When you start focusing on this insomnia itself and pushing yourself to be able to sleep, you're almost assuring yourself that you're not going to be able to sleep. So the first thing that I want to tell my insomniacs watching this is that no matter what you've heard about chronic sleep deprivation, having insomnia is not going to make you drop dead. Yes, it's not ideal. We need to get a good amount of sleep every night, but I want to reassure you, if you're one of those people that, like some of my patients have thought, if I don't sleep, I'm going to have a heart attack, or something really terrible is going to happen to me. I'm going to have a stroke, like all of these scary things. That's simply not true. And people with insomnia hear these findings about chronic sleep deprivation that come out in the news or, in other sources of media, and they way overestimate the risk that it applies to them. All right, so let's talk a little bit about treatment of insomnia. So when I have someone coming to me that's telling me that they're not sleeping well, I always start with two things. So first thing I'm gonna do is look for an underlying cause of the insomnia. And the second thing I'm going to do is work on sleep hygiene with them. So let's back up to that first one. For the most part, I would say that when people come to me and report that they've started to have insomnia, it's almost always secondary insomnia. So it's almost always due to something else. Insomnia, when it starts off as secondary insomnia, can certainly become primary insomnia, which means it sort of is something that propagates itself. But it almost always starts out as secondary insomnia. So what are some things that can cause secondary insomnia? The most common things I see are depression and anxiety. So there are distinct changes that happen in the brain in depression and distinct changes in sleep pattern that happen with depression. And depression can cause changes in your ability to fall asleep and to stay asleep. Something that often happens in depressed people is that they will have something we call early morning awakening. So they will wake up at like 2 o'clock, 3 o'clock, 4 o'clock in the morning and just not be able to get back to sleep. So whenever I hear about somebody having this early morning awakening, that throws up a couple red flags that there may be depression underlying their insomnia. Almost everybody with anxiety is going to tell me that falling asleep is an issue for them. Then they may or may not have difficulty staying asleep as well. So for these two conditions, what we're going to do is treat the underlying mental health condition. So we treat the depression, we treat the anxiety, and the insomnia gets better. Another thing that can certainly cause insomnia is substance use disorders. So I cannot tell you how many times I've seen people swear to me that they have to take marijuana in order to sleep. And they have this terrible insomnia that has just not gotten better over time. Once we are able to get them off the marijuana, which, you know, people are often using to self-medicate for depression, anxiety, whatever it may be. Once we get them off the marijuana and kind of work on sleep hygiene, which I'm going to talk about in a moment, their sleep gets significantly better. Same thing with alcohol. People swear up and down to me that they need to have a drink in order to sleep. But like the marijuana, it may work initially, but it causes more problems than it solves. People that use alcohol to sleep will find that they do fall asleep a little bit faster when they're drinking, but we know that their sleep, and especially the deeper REM stages of sleep, is going to be negatively affected. So of course, a variety of medical problems can also cause insomnia. So those are things that I'm going to look for when I first hear about insomnia. So for example, things like thyroid problems can certainly cause issues with sleep. Anytime someone has a pain condition, especially chronic pain, that can certainly interfere with sleep in a negative way. All right, so that's kind of the idea with secondary insomnia. So then some people do develop primary insomnia right off the bat, but many people, it takes a secondary insomnia to kind of kick it off, and then the insomnia takes on a life of its own and becomes this primary insomnia. So a primary insomnia happens when someone is afraid of not being able to sleep, worries about not being able to sleep, thinks about the negative consequences of not being able to sleep, or expects that they're just not going to be able to sleep. So in all, there are sort of these negative cognitions about sleep that someone has that causes them to develop and propagate this insomnia. So those are the two main types of insomnia, primary and secondary, and that's a big part of the initial evaluation in someone with insomnia is, you know, is there something driving this insomnia, and if so, how do we treat that? For both primary and secondary insomnia, we are going to use something called sleep hygiene. Sleep hygiene is something that you can Google and come up with like a million different sources of information on this, but it is kind of simple sounding, but very tried and true, and a lot of people don't buy into it because it doesn't necessarily work the first night you do it. But basically, to give you an idea of what sleep hygiene is, so we're talking about different habits that can improve your quality of sleep and your ability to fall asleep. So what we're going to do is use the bed for sleep and sex only. So no working in bed, no watching TV in bed, that sort of thing. So you want your mind to think bed equals sleep or sex. And if you're doing other things in bed aside from those two things, your brain is going to start to associate your bed with other things. We also want to do things like limit caffeine in the afternoons. Many people really have to limit it to no caffeine afternoon. As I discussed earlier too, we want to limit other substances like marijuana and alcohol that can negatively affect sleep. You want to establish a bedtime routine, and this should be something that takes longer than 5 minutes and can really be anything that sort of winds you down for the day. So things like washing your face, brushing your teeth, maybe reading for a moment, you know, kind of settling down. Some people taking a bath. Really anything that kind of gets your mind primed for sleep and that you enjoy and, you know, can use to kind of relax you. You want to avoid blue light leading up to bedtime. So ideally within a couple hours of going to bed, you want to avoid blue light. So blue light is something that we get through electronics. So computer screens, phones are a big offender. TVs, all of that stuff, you really want to try and avoid that close to bedtime. If you absolutely can't, so like, you know, I have work that I have to get done and I can't log off of my computer at a decent hour, then think about installing some software that can remove some of that blue light. So I use Flux, which is a free program that'll remove that blue light for you. And there are settings on iPhones that enable you to do this as well. So another part of sleep hygiene is that we don't want to train your brain to get used to the bed being for things other than sleep or sex. So if you are laying in bed awake and you're not able to sleep and you're ruminating about it, or you're anxious or your thoughts are just wandering, After 15 minutes or so, I want you to get out of bed, do something sort of relaxing, again, avoiding the blue light. And then once you're feeling tired again, go back to bed. So that can help break that cycle of getting into bed and thinking, oh my God, I'm not gonna be able to sleep because I associate this bed with being unable to sleep. The other thing you wanna do is have a routine. So you want to wake up at the same time every morning and go to sleep around the same time every night. Yes, this includes weekends, which can be kind of a buzzkill, but good sleep is worth it. And having a routine like that is going to get your mind primed for sleep, and your brain is going to know what to expect, and it's going to like that. Getting some exercise is also a great way to promote sleep, but you want to avoid high intensity or strenuous exercise within a couple hours of bedtime because that's going to work you up. You also want to avoid like large, heavy meals before bed or really fatty, greasy, spicy, or acidic foods right before bed, because all of those things can keep you awake and cause heartburn, which can make it really uncomfortable to sleep. You want to have a nice environment for sleep. So make sure that you have a pillow that's comfortable. Make sure that your room is set at a comfortable temperature. For most people, this is going to be below 70 degrees. You want to have your room be on the cooler side. You want to try and limit the amount of noise in your room and limit the amount of light in your room. So if you live in a big city like I used to, white noise can be a godsend. So especially for people that work night shifts and try and sleep during the day, you want to limit the amount of light getting into your room, and things like blackout curtains can be helpful for that. So that's the Skinny on sleep hygiene. So say we've treated your secondary causes of insomnia and we've worked on your sleep hygiene, and that's good. And you still are struggling with insomnia. So for people who are still struggling with insomnia, the most effective treatment has been shown to be something called CBTI, so cognitive behavioral therapy for insomnia. CBTI is like a freaking miracle. It is by far and away the most effective treatment that we have for insomnia these days. Much more effective than any medication, and the effects last for a much longer period of time. So we're talking like 80%, 90% of people that really engage in CBTI are gonna find that it has a significant benefit for them in reducing the amount of insomnia that they're dealing with. CBTI is probably best done with the aid of a therapist or a psychiatrist who's proficient in that. But I understand that not everybody has access to this. So I will link below some self-help sort of workbooks that can help you go through CBTI. But to give you kind of an overview of it, what we are trying to do in CBTI is retrain your brain that the bed equals sleep. So what you start out doing is, for a period of time, you're going to keep a sleep log. And what this is going to measure is the amount of time that you spend in bed. So you're going to log when you get in bed and every time you get out of bed, and the amount of time you're sleeping. So obviously when you fall asleep, you're not going to be able to write it down. So you're just kind of making a best guess. So you're going to write down, maybe I went to bed at 8 p.m. and I didn't fall asleep till probably around 10 p.m. And then you're gonna write, I woke up at 4 a.m. I felt like I couldn't really get back to sleep, so I think I was up till 5 a.m. and then I slept a couple hours, but I was in bed that whole time and then finally got out of bed around 7 a.m. So you're kind of keeping a log of those two things. And then once we have a good sense of how much time you're spending in bed and how much time you're actually asleep, we try and match those numbers. So what we're gonna do is say, okay, how much time am I actually sleeping at night? So say the answer for you is 4 hours. So what we're gonna do then is limit you to 4 hours a night in bed. So we're gonna tell you, say you have to get up at 7 a.m., you're not allowed to let yourself go to sleep until 3 a.m. And what we're gonna do then is, over time, you're gonna start to adjust to some of that. And we are going to slowly walk back that time in bed. So you're spending a little bit more time in bed, over a period of days to weeks to months. And eventually you get to the point where you are spending time in bed, and that time in bed is actually time asleep. So eventually you get to a place where you're able to go to bed at midnight and sleep until 7, and able to go to bed at 11 and sleep until 7. So that can be an incredibly effective treatment for insomnia. And again, I will link workbooks down below that can be used for this, and we'll kind of explain in more detail how this process works. So we can also use medications for the treatment of insomnia. The downside of doing that is that they don't tend to have a treatment effect. They sort of put a band-aid over things, but they don't actually fix the underlying problem. And some of these classes of medications do run a risk for addiction and potentially side effects like oversedation the next day, falling, doing weird things in the middle of the night while you're sleeping. So the medications that we can use for sleep are, I kind of group them into 3 different categories. First are benzodiazepines. So benzodiazepines like clonazepam, temazepam, Ativan or lorazepam, all of those can be used for sleep. Then we have what are called the non-benzodiazepine hypnotics. These are things that you might see on TV, newer medications like Ambien or Lunesta, isoprolol or zolpidem, for example. And for the benzodiazepines and the non-benzodiazepine hypnotics, most of them are going to be most helpful for sleep onset disorders. Some of them are more helpful for maintaining sleep throughout the night, but that's something that's a little bit more difficult to treat with medications. And then the third category of medications that we can use, I just sort of refer to as other, or like a grab bag of medications. And these are medications that don't necessarily fit as benzodiazepines or non-benzodiazepine hypnotics, but they can still be helpful. So one in particular that I use is called trazodone. It was first developed as an antidepressant and was way too sedating to be used as such. So we started using it as a sleep aid. One that you can get over the counter is melatonin. That's usually where I start with people because it is a very, it's a medicine that has a very low risk for any sort of side effects. It kind of helps regulate your natural sleep-wake cycle. One thing that a lot of people do erroneously with melatonin is they take it right before bed, and really it's best to take it around dinner time because you need it to have some time to work to help with these sleep-wake cycles. Sometimes we'll use antipsychotics to help with sleep. So things like Seroquel or quetiapine can be helpful. But of course, those are going to come with risk factors. And then there are certain antidepressants like mirtazapine, or Remeron is the other name for it, that can be helpful for sleep. But melatonin is an over-the-counter option. Benadryl is something that some people use, but again, antihistamines are going to come with their own risks, such as oversedation. They may dry you out. They increase the risk for falls if you're an older individual. So all of these things, you know, if you're thinking about starting an over-the-counter supplement for insomnia, I think it's worth getting your physician, your primary care doctor, or psychiatrist to look over what you're thinking about taking and help you decide whether that's safe for you or not. And then of course, like I mentioned earlier, there are these potential causes for insomnia. So you want to make sure that somebody has taken a look at all those possibilities and treated you if you need treatment. So that's kind of a super quick overview of potential causes of insomnia and what you can do to treat insomnia. I will talk more about this subject later, especially if you guys have any particular questions about insomnia or treatments for insomnia, please leave me a comment below. If you want more videos like this, please hit like so I know that this is the kind of stuff you want to hear about. And if you haven't already, please subscribe and hit the notifications bell so that you know every time I post a new video. And I will keep working on bringing you these mental health tips. And please, like I said, let me know if you have suggestions, comments, or questions. All right, see you guys later.